Good afternoon, everyone. It's December the 28th, 2023. Today I want to talk to you about something interesting that people keep asking me, and when I talk to people, and especially I wanted to say a little bit on the immigrants that I talk to as well, and I keep asking them, one of the questions I ask them is, why did you choose Canada to come and live? What is it about Canada? And I've been getting some interesting responses on it. And one of the people I was talking to, it was very interesting because he was mentioning to me that he's only been here for a couple of years. And I said, well, why did you come to Canada? And he said, well, it was because my relatives came in the 1980s to Canada. And it was such a great place, and they were making a good living, and everyone was good to them. They worked hard, and they thought it was a great place. So I thought this was where I wanted to come 2 years ago. So he said his relatives suddenly started saying, no, don't come to Canada. It's not good anymore. He couldn't understand that, but he came anyhow. And with all the opioid addictions and stuff that he's seeing now, and from them explaining to him what we had back, even the 80s that made Canada so good, they were explaining what made Canada good, and now they're so upset too that they can't understand with the opioid addiction and why we have everything so upside down. So I'm talking to these immigrants, and I'm saying, yes, that's what we're seeing, and I was born and raised here in Canada, and so I'm thinking back, and I'm trying to figure out, and a lot of us are trying to figure out, the baby boomers, like, what went wrong? Why is our system so broken today? And this morning I was going to the grocery store, and I saw something that made me stop and think, and I watched, and I observed what was going on, because it hit me. One of the reasons that we're having a problem today, from the time that I was raised and taught. And I want to explain. I saw the police car there. I saw the ambulance pull in when the fire trucks pull in at the same time. I'm not sure if someone had taken an overdose, but they come up to an underground parking lot. And, of course, I couldn't see at first what was going on. But there was someone, I guess, down. And whether it was an overdose or not, I'm not sure. But when I went into the grocery store, I was able up higher and got a better advantage of what was going on at the time. And I saw the two firemen. Well, the paramedics went down. I guess they were able to get him on his feet. So I saw two firemen, one on either side of him, helping him up to the ambulance, and wondering if maybe he just tripped because he had a patch over one eye. So I wasn't sure what happened there. But they got him into the ambulance. So I'm thinking, in the spring, we had such a bad time with all these overdoses. And I mean, everyone was just dropping here like flies. And our emergency services were so overwhelmed that they couldn't do the job. Well, and that's one of the things that I noted and needed to put on my YouTube channel here and see if we could get some help. And thankfully, we're getting help. We're getting more paramedics coming in as well. And of course, we're going to have to buy ambulances again, more of them, probably. But that's a good thing. We're getting a few more police officers, too. That's another good thing. But we're looking at different ways. But what I was thinking of, what I was brought up with was, when I looked at them, they were doing what I was brought up with. All three. You had the police department, the fire department, and of course the paramedics and the ambulance service. They were all working as a team to get things done. And then it just hit me. Oh my gosh, that's one of the things that I was taught as a child, was teamwork, working together. Just as the goose says, shared leadership. And I'm thinking, oh my gosh, that's what we've really lost. Because everything was about teamwork. Okay, we had sports back then. And it wasn't about a matter of whether we won or lost. It was a matter of having a good time. Like I come home because I was good in track and field, I come home, I'd be at the track meet, come back, and my mom and dad and my grandfather would say, gee, did you have a fun time today at your track meet? And that was, and it was about the camaraderie, as we still say in sports, but it's got ruined between the sexual abuse, like right across the board. This is a horrible thing that's coming out of the closet now. And then we have these parents who, it's not, to them, it's not fun anymore. They're jumping down on, say, the rink, for example, beating the crap out, unfortunately, out of some of our referees because they're not happy with the decision. And it was never like that when I grew up. And I'm just using the hockey as an example. One of our, of course, our main sports here, Canada's known for is hockey. And I'm thinking about all these different things, and then I realize it's like a chain with the fire department, the police department, and the ambulances all working together. That was a chain and the link. They're just all three links in that big chain. And then I'm realizing where the chain is broken, this link is suddenly very rusted out, is when the ambulance delivers the party at the hospital, our healthcare system is falling apart so badly, it's rusting out. We haven't got enough people. Number one, we can't keep the people in the healthcare system. We're lacking. We don't have enough beds. We don't have this. We don't have that. This is where the link in the chain is broken. And because how do you get people waiting in waiting lines when you've got emergencies, when sometimes it's a life and death situation, and we have people die sometimes in the waiting room because they can't get in. Then I'm thinking, well, what I saw this morning and what I know down here with all the overdoses, the emergency crews, well, they try to get them in. They got overwhelmed. The hospitals are overwhelmed. So it's important for these people, when they are in an emergency or an overdose situation, if all these three bodies, our emergency services, are all working together in a teamwork situation, they get this person to the hospital. It's like, oh my gosh, this is where it's broken. And it's imperative when they get the first part of that chain gets to the other part of the chain, if it's a matter of life-death situation. And we can't, right now, we're getting them to the hospital as best we can. And people are, like I said, dying in the waiting room sometimes. And they're so overwhelmed. The link in the chain is broken. It's totally rusted out. We've got to find a way to get that back again. So this is one of the things, this is what I want to talk to you about this morning, is teamwork. Because that's what I grew up with, was teamwork. Working together as a community. So this is why I'm into the community work today. This is why I go to community meetings, trying to make it better. And trying to figure out, well, looking back and saying, well, how did we do it in the so-called good old days, as I put it? And why was Canada so much better? And why we work together? Then I'm looking back at my own community that I was raised in as a child and realized, okay, if we had something such as, let's say we had this bad intersection and so many people were getting killed at this intersection in the community, we'd get together in someone's living room, and it wouldn't be bad things. It would be, we'd be having a cup of tea or something like that. And we'd be talking about, well, what can we do to make this intersection better? We need to talk to the city about it. So we'd be strategizing, for example, on ways that we might be able to make the intersection more safer. And then we bring our proposal to the city to see what they could do about it as well, and what were their ideas. So this is how we shared this part of the leadership and worked with our communities, worked with our municipal level of government, because it was a city matter. So this is just one level, and this is how we did it. But oftentimes, what I'm seeing today, I think what's breaking the link is what's happening is that people are not listening to one another. They want to go on Zoom. It's not so personal as it was. I'm hearing that the big chain stores are going back to when they're referring to the customer service. People do not have the people skills anymore. It's great. I'm glad that we have this information so I can put this out to the world today. But when it comes down to a personal level here, we need to get back together. It's not like being in a big conference room always. Sometimes it's good. But I know when we were doing things, it was always done more on a personal level in someone's living room. So I can understand why people want to do things over a Zoom meeting. And of course, I'm trying to learn that now too on my phone as well. But it's a matter of people need to be in contact with other people. We're separating ourselves. The machines, this equipment's also separating us. So, I mean, when you can meet in someone's living room and do something good, and that's something that's really, really good when people get together at a grassroots level. And this is how we worked, was at a grassroots level. And why are things going wrong? Because when you get all these gangs and everything, they do it in the grassroots level. They'll meet in someone's living room and they'll do their strategy. But it's not like us planning on, okay, we've got a bad intersection here. What do we do about it? While they're in there planning, while these young guys are in there planning what they're going to do bad to society. So these are the things that I'm seeing. We need to get back to, as I said, the shared leadership. But we need to go back to being a team. Bring ourselves into being a team again at different ways. So I don't want to make the video too long today, but I'm going to be bringing things like this forward that I see. I'm going to be bringing more forward what I'm hearing from the immigrants as well. So I want to let people know there's a lot coming and how we can make Canada better again. But we need to sometimes go a few steps back and use what's good in those few steps back and try to bring them up to today's standards and how we need to use them. Because person-to-person contact is so terribly important as well. That's one of the big things that we are losing. So, again, everyone, have a great day, and we shall talk to you again soon. And bye-bye.